Dr. Michael Lepore coming to you on Whiteboard Wednesdays once again from Sarasota Vascular Specialists. Today, I'm going to give you a little peek inside the vascular lab and behind the scenes so that you can get a little understanding of what it is a vascular lab actually does, what it actually is, and why it is such an integral part of helping us as vascular surgeons really manage a vascular patient's care. What do we mean when we say vascular lab? Well, the vascular lab is a place that a patient will come to undergo ultrasonographic imaging with a machine that uses sound waves in order to be able to visualize different arteries that are distributed throughout the body. There's also some other testing that's done in the vascular lab that checks how the perfusion is in different areas of the body. The important part of this with regards to a vascular surgeon's general function is that it allows us to minimally invasively or non-invasively image all patients' arteries and veins in most locations. Some areas we can't get to and we have to use different modalities of imaging that are not in the vascular lab, but it becomes critical to diagnostics and also to recognition of patients' problems that they come to us for evaluation, and most importantly, surveillance down the line, whether it's any progression that may bring us to need to intervene, or even after we've performed an intervention to make sure that the patient doesn't have any type of recurrence or other issues. The players really are critical with regards to that, and that's our RVTs, which is registered vascular technologists. And they are specially trained to perform these procedures and really work in an integral manner with us in order to be able to care for vascular patients and understanding the different disease processes and how they are affecting a patient. The tests are really mostly carotid arteries here in the neck, the aorta, which is going to be mostly the abdominal aorta because the thoracic aorta up in the chest we cannot image due to the bones in the chest that do not allow us to image that portion, requires a CAT scan to really see that. The kidney arteries, which is renals, which obviously give function or flow to the kidneys and can have an effect on all different types of things and also have an effect on blood pressure with regards to blockages in the kidney arteries. Mesenterics are the arteries that go out to supply the gastrointestinal tract. And those become very important, obviously, because without those arteries, it's difficult for that portion of the body to really function. Extremities, whether it's the upper extremities or it's the lower extremities, there's imaging, which means we use the ultrasound to really look at the veins in the artery, both the veins and the arteries in the upper and lower extremities, or physiologic studies, meaning we're looking at the arteries to see what the circulation looks like, what the perfusion looks like. It basically registers a waveform that allows us to understand how severely diseased an upper or lower extremity is based on the findings that we find, whether it's on the fingers, the toes, the wrists, the upper extremities, or the lower extremities. Venous is all the veins, and that's basically pretty much all over the body where we can identify venous problems with regards to valvular problems, blood clots in the superficial system or in the deep system, which are considered to be DVTs, evaluating lower extremity edema or upper extremity swelling, and those become very important with regards to the management as well. And dialysis access. And dialysis access is a way that patients can go to dialysis, and we are, as surgeons, create a circuit in some way that is going to be covered by many other talks with regards to being able for patients to go through dialysis. But that requires looking at the veins and the arteries to try to determine what the best access for a patient would be. Once again, the vascular lab is critical in a vascular surgeon's life and a vascular patient's life because they really work all together in order to provide the best possible care, whether it's through screening patients, whether it's through surveillance in terms of finding any type of progression of disease in a patient or following up after an intervention. Our RVTs are registered vascular technologists and an integral part of functioning here at Sarasota Vascular Specialists to help us care for patients. And then the tests I've already covered. Michael Lepore with Sarasota Vascular Specialists here to talk to you today about behind the scenes at the vascular lab.
you.